Morning. My name is Elisa Kachigas. I'm one of the faculty members at the University of Washington Maternal Fetal Medicine Division. And I'm here this morning with Dr. Linda Eckert to discuss the ACOG practice advisory on vaccinated pregnant and lactating patients against COVID-19. This was originally published in December of 2020 and has been recently updated April 28th, 2021. We're going to start by having Dr. Eckert introduce herself, and then we'll continue on with some questions.
Hi, thanks for joining. I'm Dr. Linda Eckert. I'm a professor of obstetrics and gynecology and also an adjunct professor of global health at the University of Washington in Seattle, and am a member of the ACOG Expert Immunization Committee, as well as the ACOG liaison to the CDC's Advisory Committee for Immunization Practices, or ACIP. I was one of the co-authors of this ACOG practice advisory on immunizing pregnant women and lactating individuals with the COVID vaccination. So glad that you could join us today.
Okay, Dr. Eckert, why don't we start with what your takeaways are from this ACOG practice advisory? What is your sort of elevator pitch about what this practice advisory is about?
Well, thank you. I actually think this is a really practical document. It has a lot of great sections in it. But one of the take homes are important points to go over with your pregnant individuals when you're counseling them about COVID vaccination. It also talks about safety of the vaccines. It talks about essentially a little bit about how the vaccines work. And as we periodically update this document, we include more and more data as it's becoming more available. So our latest update included data about the brief hold on the Janssen vaccine, as well as an update of safety information from the CDC on their VC Safe Pregnancy Registry. So we really hope this is a practical document that providers can use and refer to when they're talking to their patients.
Dr. Eckert, I know that you see patients in clinic, and I was wondering if you could start off some questions about pregnancy just by saying how you talk to your pregnant patients about whether or not they should be vaccinated, what you recommend, how that discussion goes down.
Yeah. Well, I do think it's important to have that discussion on an individual one-on-one basis. I always start by listening. Like, what are your thoughts about the COVID vaccine? Have you had it? Are you interested? Is there information I can provide for you that's useful? I definitely try to review the danger of COVID in pregnancy, which is very real and is becoming more and more well documented with newer studies, including global studies that show marked increased risk for pregnant individuals should they contract COVID of hospitalization, intensive care stays, even death. And none of these factors, if they get really sick, are that good for their baby either. So I try to give an overall view of COVID and its dangers in pregnancy. And then I talk about their situations in particular, like what would be questions you would want to know from your patients. You see pregnant patients as well.
Yeah, I think one of the questions that I get a lot from my pregnant patients is what type of vaccine I would recommend of the three that are available. Do you have any, tips that or comments that you make for your patients?
Well, I am still of the mindset that any vaccine that goes in your arm is a good thing. But I feel like, we have a little more experience now with the mRNA vaccines just because of the number of doses given. And if we look at what is in CDC data, it more reflects the mRNA vaccines. We have the ability to talk to them about mRNA vaccines that they really do not have an exchange of genetic material within pregnant individuals, that the DNA or the mRNA material in the vaccine is quickly dissolved in their bodies. It doesn't integrate into their genetic material, as this is a common fear I hear from patients. And then another thing patients often ask me is the side effects and worry about fever, because we always teach our patients that we prefer them not to have a long-standing high fever in pregnancy. And so I definitely recommend Tylenol, that if they develop a fever, to take Tylenol, and Tylenol is well proven and safe in pregnancy, and to use that as they need to really try to help them if they do have impact from the vaccine, such as a fever or aches and pains, etc. What do you think about the viral vector vaccines? How do you talk to your patients about those?
That's a good question. I think in general, we do have some data on viral vector vaccines in pregnancy with the Ebola vaccine, and that in general, viral vector vaccines seem to be safe in pregnancy. So we're still gathering some data, it sounds like, from Janssen, but overall seem to be well tolerated. Mm-hmm. And so speaking of viral vector vaccines, here's a question back to you. What is your take on that hold that was placed on the Janssen vaccine, the Johnson & Johnson vaccine, especially since we're a little bit more concerned about clots in pregnancy and the immediate postpartum period? I know that the vaccine's not on hold anymore, but what would you tell other providers about that?
Yeah, I think that's a really important point, and clearly a point that our pregnant individuals will have heard about and that I think we should feel comfortable addressing. What I tell people is, first of all, I think the fact that this very rare but serious type of blood clot was picked up is fundamentally an affirmation of how good safety data we can track in our country. If you can pick up a side effect of a vaccine that happens to 7 per million individuals, you have a really good safety tracking mechanisms. So overall, I try to say that this, it's a serious side effect, and let me talk about the side effect in a minute. But what I really want you to know is that we are paying very careful attention to safety. And the fact that we picked this up just shows that the safety mechanisms that are in place are working exceedingly well. And then I talk a little bit about this particular side effect that was found. These types of blood clots are associated with platelet activation and low platelets then leading to the thrombosis. It's a very rare type of blood clot that's serious when it happens. It can happen in the brain, it can happen in the abdomen. It typically happens about 6 to 14 days after the vaccine. And even in women under 50, the rate was still pretty low. In my opinion, it was 11 per million, which is serious when they happen, but overall, compared to the rate of COVID and the deaths from COVID, that's much, much lower. However, it is possible that if they were concerned about this vaccine, they could choose a different vaccine. We're fortunate to have different vaccines available. And that the other thing I do want to say is that it's true, women who or individuals who are pregnant or on contraceptives or so forth, we always talk about the increased risk of blood clots, but the blood clots associated with this Janssen vaccine are of a different mechanism. And the mechanisms are do not cross. And it doesn't mean that just because you're pregnant, you have an increased risk of developing this side effect with the Janssen vaccine. That isn't true. There are different mechanisms, at least as far as we know, it's not true. Again, we're continuing to track safety data, but we haven't seen that to be true at this point.
So if a patient came in and said, I got the Janssen vaccine, all this new data came out, or we've heard all these reports, it sounds like you'd be reassuring to the patient.
I would, and I would say the things you look for are, again, this is spoken to as well in the practice advisory, but, severe headache, abdominal pain, change in vision, the typical time frame is 6 to 14 days out. And to just remind them of the denominator and the numerator, in individuals that are female under 50, it was about 11 per million. So that is not very common. Many of my patients are happy to get the single dose vaccine and the ease that the Janssen vaccine offers. So I am glad we have it back in our vaccine armamentarium, because I think for some individuals, it's very, very helpful to only have one dose.
Okay. Switching gears a little bit, over the last, it's been an exciting time. There have been a lot of studies going on and a lot to learn about COVID-19, and thank goodness there's a vaccine now. Could you talk a little bit about some of the studies that have come out in the last month about vaccine safety, or even about potential benefit to the neonate from the vaccine?
Yeah, I think we are learning more and more, and this is a rapidly evolving field. And so it seems like every week there's 2 to 3 papers coming out. We're learning what we would expect to find, which is that the antibodies that the mother generates are passed through cord blood to the baby. So a pregnant individual who's vaccinated is able to pass antibody, IgG antibody, to the baby through cord blood. We're also learning that the pregnant individual will make IgA antibody and pass through the breast milk. We don't have really good studies yet on how long these antibodies last and the level of protection it offers to the infant. These will be studies that are going forward, and we'll continue to learn more and more. But this initial learning about the antibodies being transferred is exactly what we see with other vaccines. So we would expect this to happen. But nevertheless, I find it encouraging, and I find it encouraging to talk to pregnant individuals and say, if you are vaccinated, you are absolutely able to pass that protection over to your infant. And I think that's an important message.
And then the CDC put out a study, I think, on VAERS data and the VSafe app data.
Yeah, that New England Journal paper that was just recently published. And I think what they have found, which is encouraging, is that, you know, the CDC is enrolling pregnant individuals who get the vaccine in an ongoing vaccine registry. And then they actually contact them and they actually get their medical records and they verify the outcomes of pregnancy. Now, because getting this type of data takes a while, the current number of people that we have in the pregnancy outcomes that they reported on in the New England Journal was about 275, I believe. And what was encouraging is if you looked at the pregnancy outcomes of those individuals, they had the same expected rate of preterm labor or preeclampsia, of hypertension. They did not have an increased risk of miscarriage. They did not have an increased risk of stillbirth. And so again, we'll continue to get more data, especially data on pregnant individuals who are vaccinated early in their pregnancy, because it just takes a while for those individuals to move through the system and to get their outcome data. But what we are seeing so far, mostly on individuals who are vaccinated a little bit later in their pregnancy, is that we aren't seeing increased risk of any obstetric outcomes. And so this longitudinal data, as we follow people forward, will be continued to be tracked. And I know that there are other investigators as well who are looking at longitudinal data, tracking outcomes. And so this amount of information on safety will continue to increase going forward.
Okay, great. And then one final question kind of to wrap this up is, how do you see the vaccine kind of landscape for pregnant people in the future with this COVID-19 vaccine? Do you think we're going to need boosters? Do you think, you know, how soon are we going to get more safety data? Are there any clinical trials ongoing or observational studies, things like that?
Yeah, well, I do think we're going to continue to get more and more information. Pfizer has announced in February that they started their phase 3 trial involving pregnant individuals. That trial had a blinded arm, and it couldn't be performed really anymore in this country since all pregnant individuals are eligible to get the vaccine at this point. And so you can't really offer a blinded clinical trial. It's not really ethical. But there are observational studies going forward looking at the outcomes of pregnant individuals and their babies. I would also say that the phase 3 trials that Pfizer announced, and I'm sure are ongoing in other countries, and they are saying that they hope that we will have data toward the end of 2021 or early 2022. I think that like we talked about, the safety data will continue to get more robust. We're going to learn more about the antibody transfer. Is there a best time to give the vaccine during pregnancy? I think right now that point is quite a minor point compared to the idea that we're still in a pandemic and that people are still dying from COVID, and that you should get the vaccine instead of trying to idealize. If you think, well, if I get it at 22 weeks versus 26 weeks, is that better antibody transfer? What you really need to remember is we are in a pandemic and COVID is still spreading, and pregnant individuals are still being hospitalized at a greater rate than non-pregnant individuals. And getting the vaccine when you can get the vaccine is what I would advise patients right now, rather than trying to pick a specific gestational age. How about you? If you have patients that ask you, should they wait, should they get it now, et cetera, what do you tend to tell your patients?
Yeah, I tell them that the preliminary studies show that it seems to be safe in pregnancy, and I do talk about the risks of COVID-19 infection in pregnancy. Now, there are some individuals who are very anxious about the vaccine, and, depending on what their risk factors are for getting infected, we kind of have a discussion about whether it makes sense for them to delay getting vaccinated just because of their anxiety level or their discomfort with the idea of getting a vaccine that is not thoroughly studied in pregnancy. So ultimately, it's up to the patient, but we do have a good discussion about it.
Yeah. And, I guess we should mention those risk factors like gestational diabetes, obesity, hypertension, immunocompromised in any way.
And occupational exposures, household transmission, things like that, that some people just can't control.
Yeah, some people really cannot isolate themselves and cannot protect themselves in the same way. And I do think those are all factors that I also encourage my pregnant individuals to consider when they're deciding whether to get the vaccine. We haven't talked that much about lactating individuals. And I do think that the American Academy of Pediatrics and lactation societies have all come out full bore in recommendation of lactating individuals to get the vaccination, that they're really, there are not safety concerns that we know of, and there are benefits that we can appreciate. And so really there isn't any thought about lactating individuals needing to be aware of getting the vaccine at this point.
Okay.
Yeah. And then, the other thing I do talk to my patients about that we don't always, I think, recognize is that the postpartum time is a really difficult time. You're exhausted. It's very hard work. And a lot of times some of the extra support you need and you receive is from other individuals who are helping you at home or bringing you food or so forth. And one of the factors that I encourage my pregnant individuals to think about is, will they feel more comfortable accepting that help if that help is available to them if they're vaccinated or the people around them are vaccinated? And I think there's some intangible benefits of the vaccination that are not as easily measured or that we don't always talk about, but that definitely those intangibles can improve the quality of life for an individual in that very difficult postpartum time.
So kind of talking to them also about the postpartum period and maybe suggesting that cocooning we talk about with Tdap, having other family members make sure that they're vaccinated, and that would also apply to the COVID-19 vaccine.
Exactly. Yeah. Yeah. Anything else that I haven't touched on that you touch on with your patients or that you think about?
I think we've talked about most things.
You asked about a booster. I think the booster question is still out at this point, in my mind. Do you have an opinion about that?
No, I kind of wonder about all these variants coming out. I wonder if we'll have like a combo vaccine coming out at some point, but who knows?
Yeah.
The one other thing to mention is just that 2-week interval between the COVID-19 vaccines. If it's a 2-dose, the Pfizer Moderna with the Tdap, sometimes that can get a little bit complicated, but
yeah, that's true.
It's recommended to give it 2 weeks apart.
Yeah. And the other thing I would stress to all my pregnant individuals, we're seeing more and more data about people not returning for their second shot. That second shot is really important. It really increases your protection level and your immune response to the vaccine. And, I would say that I'm definitely going to stress my patients that if they're in the 2-dose vaccine of the mRNAs, that they get both doses.
Okay. Well, Dr. Eckert, thank you so much for talking about the COVID-19 vaccine and pregnancy and lactation. And I think this concludes our Q&A.
Yeah. Oh, one other thing, the ACOG advisory is updated on a regular basis. And so this latest one was just last week after the Janssen pause. So continue to look for updated information coming out in the practice advisory as more and more becomes available.
Okay.
Thank you so much.
Thank you very much.
Bye.